Welcome back to another episode of Athletes in Practice, where we share the stories of former student athletes who are now making an impact in medicine. My name is Marquez. I am the host and founder of Athletes in Practice. Our goal is to help athletes realize that discipline, resilience, and leadership that they develop through sports don't end when their playing careers do, but more so they become the foundation for caring for patients and leading healthcare teams. Today's guest is someone that I'm really excited to have on our podcast because I've had the privilege of working alongside her for a long while at Bernardo Dermatology as a medical assistant. Um, it's been amazing to watch her care for patients, see how she goes through her day to day, and how now I get to learn how athletics has kind of impacted and shaped how she practices medicine, how she treats her team, including myself. So, Dr. Vanessa London, thank you so much for joining me on our show today. Dr. London is a dermatologist at Bernardo Dermatology. She completed her undergraduate education at Cornell, earned her medical degree at Case Western Reserve University, and then completed her residency at USC. Before she got into medicine, she was a Division I volleyball player at Cornell University, a journey that fits perfectly what athletes in practice is all about. So, Dr. London, I think it would be great if you could start off by telling us a little bit about your journey to playing Division I volleyball and then moving forward, your journey into medicine.
Yeah. Well, thanks for having me. This is awesome.
Of course.
My life story. I grew up in Los Angeles, California. I didn't really play a ton of sports before I found volleyball. I just got exposed to it during like PE one day, and I was like, "Oh, this is like really fun." I loved it, and went and did I think like a bunch of camps or something, and then a bunch of my friends we played in middle school. And then our middle school coach got me excited about the local club team. And, once I kind of got on that, that's like, this whole moving train, right?
Yeah.
From there on
Yeah.
out. And then you see these people older than you see the next level above you. And I think kind of with my whole like type A goal setting personality, I've always been very competitive. I just loved it and I ate it all up,
Yeah.
I loved
Yeah.
every part of it. I loved getting better, like the whole
Hmm.
climb and that process was just really fun for me. Plus, I just love volleyball. I mean, I fell in
Yeah.
love with the sport, had so much fun. I was a setter, loved that position, like just being in control of the whole entire play, running the offense, always trying to better the ball, all that stuff.
Yeah. Yeah. That's the one where it has to be like quiet when like you put it out. That's the one I know
Ideally,
of. Ideally. Okay.
ideally,
Yeah.
like really soft but strong
Yes.
hands. Yes, yes.
Nice.
And yeah, you make friends that are family on those teams and you travel and you spend so much time together and it's just a blast, right? I just
Yeah.
think it's
Yeah.
such a great way to grow up.
Uh,
And then yeah, around like 10th, 11th grade, decided, okay, I want to play in college. Um, my recruiting, it's funny because I think back now that Max, my
yeah.
15-year-old is going through the whole thing with lacrosse, and I'm like, God, it is such a different recruiting journey these days.
Mhm.
I mean, like these kids have Instagram and they got their social media.
Yes.
I mean,
Yes.
they got like all these videos everywhere and all this like, I don't know, so much action, I should
Right.
say. And like no internet when I was growing up, right? I made my highlight video was on like a VHS.
Wow.
That's how old I am, okay? A thick VHS tape that you play in a VCR,
Yeah.
okay? My parents and I made it, and then we made like, 20, 30 copies,
Copy.
right?
Wow.
I wrote a letter to each coach. I, mailed it out in a manila
Amazing.
envelope.
Yeah.
And I don't even know how. I mean, I don't know that I was all that good, but I mean, I guess maybe, we were California, like the hotbed of volleyball. We had
Yeah.
a lot of coaches, coming to our tournaments. Yeah, and I got a lot of interest. I don't know
Hmm.
how. And mostly it was like maybe some D3 schools, but like
Hmm.
some of the Ivies, which are D1, but like they weren't in necessarily like the strongest league at that time.
Yeah.
I think now it's
Yeah.
completely different. I think the Ivy leagues are so much stronger
Hmm.
in many of the sports. But at the time, anyhow, it was just such a great fit for me. I thought like an Ivy D1 or like a D3 school. And
Yeah.
um, actually, so I went out on my first recruiting trip to Cornell. I went to Cornell and Vassar, and I just fell in love with Cornell. Like, fell in love. Just like I fell in love with volleyball. I was
Yeah.
like, this is it. The girls took me out. They
Oh,
were
that's
so
amazing.
funny. First of all, they were
Yeah.
so funny, and like you could just tell how much they got along with each other.
Hmm.
And immediately I felt comfortable. They were like making fun of each other, making fun of me, and like that teasing is such like a love language for me. And I was just like, I just love these people already.
That's
And
great.
I even told my mom, I was like, you know what? I'm good. Like I
Yeah.
had other recruiting trips lined up, I think at other pretty good schools, but I was like, I'm done. I just want to go to Cornell. And
That's
yeah, and it was just and it was great. I didn't even look back,
yeah. Yeah.
And then I just loved every minute that I was there. I mean, as you know, it's like it's your family away from home, right? I
Hmm.
mean, you spend so much time with
Oh,
those
yeah.
people.
Yeah. So.
Um, they're like your support system, they're your best
Mhm.
friends,
And that's why it's so important for it to be like a good decision on where you go,
absolutely.
right? And it's good. I'm sure your parents were happy that like you felt at home right away there. Because I know in my recruiting process, that was like a big deal. Like, my parents just wanted you to be at peace with your decision and like someplace you were super happy. So it sounds
Yeah.
like you got that right away, which is a pretty special thing.
Yeah, I was so lucky. And the fact that I was able to play all 4 years and I started and, was able to make such a contribution to the team. That meant a lot to me. And,
Yeah.
it's just like, being able to represent my school, my team, and it
Mhm.
was a really cool thing for me.
That's awesome. That's awesome. Yeah, sports is just, I think it's so special to get to do that with like a big school like that now. I mean, I don't know where in women's volleyball the Ivy League stands. I know as a Princeton grad, I know the women's team there was pretty good. I don't know how they compete with Cornell
Yeah.
anymore. I know it changes over the years, but it's
Totally.
it's
There is a lot of ups and downs in I think women's volleyball just because they're smaller teams and like
right.
you can have like I mean I know that when I was being recruited they were number one in the Ivies and
Uh-huh.
then as soon as I left they were number one in the Ivies. So when I was there I just call it like a rebuilding phase.
Uh-huh.
But yeah, there's a lot of ups and downs because, there's, not a lot of professional sports afterwards. So there's not a
Right.
huge incentive for women athletes, unfortunately, to really stick with it. I mean, by the
Yeah,
time
yeah,
I was a senior, I was the only senior on my team.
yeah. Hmm.
And so I think that just leads to a lot of like ups and downs, right? Like
Oh,
one year you're at the top,
interesting.
the next year you're like,
Yeah.
whatever.
Yeah. You would think the Ivy would be able to recruit like to be really, really good since I don't know, lacrosse what used to be similar. Now there's more professional opportunities, but like the Ivy League can get these really good athletes who know like I need to get a really good education as well.
Absolutely. And I think it
And
is much stronger now. Like I want to say like the top three might be able to go to the NCAAs now,
uh
whereas when I was
oh
there,
wow. Yeah.
it was only the tournament winner. You had to
Okay.
come in first to
Yeah.
go.
Yeah.
So
Yeah. Very cool. And then did you go to medical school right out of college? Did you take some time in between? What was that
yeah.
path like?
Yeah, I actually did take some time.
Hmm.
So, like, as you may know, in order to go straight, you kind of have to have like all your ducks in a row, like,
Yeah.
have your MCAT done, your junior summer or whatever. And I just didn't. I mean, I
Yeah.
think I was always pre-med. I did all the
Mhm.
coursework. So it's not like I necessarily needed to take time off, but it was such a
Yeah.
great thing for me. I wasn't really ready to apply when I graduated. And my parents were like, just do something,
Yeah.
do some grad program or something to keep it going. And actually, it turned out to be the best thing for me. it was very late. There was like one deadline I didn't miss, and that was the UCLA master's program in physiology. And so
Oh,
that's what I ended up doing. And I was like, great, I could go home, live at home, do
yeah.
2 years, and really figure things out. Like, do I still
Mhm.
want to apply to med school? Like, how do I want to do it? And well, it turns out not only was it good for me educationally, I met my future husband, Nick. He was a year ahead of me
Oh,
in
that's
that program.
nice.
Yeah.
Yeah,
He was
that's
actually my
awesome.
anatomy tutor.
I
Uh,
didn't know that. That's great.
yeah. And so he also helped inspire me. Like he was going to med school. And it turned out that the first year of this program was all physiology. I mean, and it was great. And I had no idea really what I was even getting into.
Yeah.
And they're like, yeah, if you want to go to medical school, like you basically just did the first year of medical school. And I was like, no way.
Sweet. All right. Yeah. Ahead of the
It was
curve. You're ahead of the
perfect.
curve, basically. Yeah.
Yeah, it was great. So I really had like not only did it kind of reinvigorate my interest in medical school, I was like, oh, I was like kind of excited to go again. But I felt that like I had that strong foundation. And then I did a bunch of research and a bunch of teaching. So I really felt like I kind of just got like boosted up again,
Yeah.
after college. And so yeah, and it really helped me get into medical school and also like in the beginning get that strong foundation
Mhm. I
and
think
confidence, right? Because I
definitely
think that like we all have that little bit of that um what do you call it? Like
a little doubt of like,
yeah, a little doubt.
yeah, yeah.
Yeah, at the beginning, you're like, oh, do I really deserve to be here?
Right. An imposter
Imposter
syndrome type
syndrome.
thing.
Yeah.
Yes.
And so, yeah, and so that it really just helped me get that really strong footing.
Mhm.
And then I really hit the ground running when it came to medical school. So that was great.
That's great. I think that has become even more a trend now that most medical student matriculants are a year or two out of college now. I know it used to be, I think, more common that you went straight through. You had all your, like, you went straight through medical school. I think now it's more the norm to take time, like you said, for all the reasons you just explained, like a maturity, I guess, to kind of sum it all up, of going into med school, knowing this is exactly where I need to be, and like I'm very confident I worked for this spot, and you have no doubt that that's where you're supposed to be during that time. Did Dr. Nick London go to med school with you, or did you guys part ways for a couple of years?
Yeah, so he actually, since he was a year ahead of me, he actually
Mhm.
went to Case Western. So he's from Columbus, Ohio,
Nice.
and
Okay,
Case is in
yes.
Cleveland. So he went there ahead of me and actually ended up visiting him a bunch of times. I love
Yeah.
the school. He wrote a bunch of letters to the dean. He's like, I really think you should let her in.
Yeah.
And yeah, unfortunately they gave me a spot, which was
That's
awesome.
amazing. That's
Yeah.
amazing.
So we were
More
able to
more
kind
so
of
that you guys got to spend school together, and not have to be apart too for those 4 years. That's a big
yeah.
deal too.
Yeah. Yeah. So we got that together and then we kind of did like residency was kind of apart,
Okay. Mhm.
but that's okay. It all worked
Yeah. Yeah,
out.
yeah, it did.
Yeah.
So you did your medical school at Case Western, then residency back at USC, right, in LA?
Right. Yeah. So he matched ahead of me. He went
Mhm.
to San Francisco for his
Okay.
ophthalmology. And so when I was applying, I was like, all right, I'm just going to try to do California, get as close as I can, at least,
Yeah.
with derm being so competitive, I was like, well, maybe if I just get in the same state, that would be good.
Yeah.
And so I was very, very lucky. Matched at USC and again got to live at home, which was totally fine. If I had to be apart, at least I'm living at home and we're not paying two rents.
Right, right.
Um, so yeah, and that was a great experience. The program director there actually, he then told me afterwards that he's like, I always love NCAA athletes. Like
Wow.
student athletes are like the best residents. And it turns out there were like three student athletes in our residency because
Interesting.
he loves sports and he just loves the sports sort of mentality
Yeah.
and really like just found that in a bunch of us. And
Mhm.
so that was kind of neat that actually even sports, even at that level, was kind of helping me, bond or,
Yeah.
make that
100%.
connection.
Like socially, and then I guess that kind of leads me to my first question for you is looking back on like your athletic experience through playing Division I volleyball at Cornell, how has that experience contributed to your success in medicine? Whether through like your habits, your mindset that you were just talking about, or even in patient care in general.
Yeah, gosh. I mean, how doesn't it? I mean, there's so
Right.
many, so many different ways. I mean, I think the biggest thing and probably most obvious, like, is just like time management. I
Yeah.
mean, like no one else, I think, puts in those out. I mean, besides other student athletes, like, I mean, there were some weeks where it's like 50, 60 hours if you're spending time on the road and trying to keep up with competitive, other pre-med students,
Yeah.
I mean, I had to learn, like, I feel like secret, pieces of time where I could like do some reading, or I would like turn on the light and I would read on the bus when everyone else was sleeping,
Yeah.
and just being really proactive with my schedule, not
Mhm.
waiting for that free time to kind of come to me, right? I'm like, all right,
Right.
well, what I have this due at this time, and when am I going to get
Mm.
it done?
Yeah.
And like in high school, I could kind of like not really stay up on things and then cram at the end. But like this was a whole nother level, right?
Right.
Like with the
Right.
amount of time that you're away. So I think that's just like the time management thing was
Mhm.
huge. I think the way that I approach everything with kind of like positive mindset, like
Yeah.
enjoy the process, not even though we're goal oriented and we're like,
Right.
okay, I want to achieve this and I want to achieve that. One thing I remember like in medical school, like your third and fourth year can get really stressful because you're on your clinical rotations, you're starting, essentially starting a new job every month, right? You're doing pediatrics 1 month, surgery 1 month, and
Yeah.
it's like you're brand new in a new environment and trying to get that like first impression out there is kind of hard. And I think that like I remember like evaluating myself a lot, being like, oh,
Hmm.
I'm not doing well, or like that didn't go well, and kind of like
Interesting. Yeah.
just being really hard on myself. And I kind of just had to step back and be like, no, I just have to enjoy the process, enjoy the learning, find the joy, kind of like
Mhm.
you do in sports. Like you can't always control the wins and losses, you can't control the outcome. Like
Right.
you control your effort and your attitude,
I love
right?
that. Yeah.
And
Yeah.
so I think that little nuance, and maybe that was from sports or whatever, that really helped me get through some like tougher times.
Definitely. I love that piece that you said about the you can control your effort and attitude, you can't control the outcome. I think that's something that a lot of athletes do eventually learn, even though that's still a hard thing to learn as an athlete, but like you learn at some point in your athletic career, but not very often do you learn that in like test taking or in school.
Right.
And I was telling you before, I'm a MCAT tutor and I try to teach that to students is like you can't control your score at the end, but you can control the effort that you're putting in right now in your practice and the effort in your studies. And it'll show up in the outcome. It'll show up in the end. And I think in medicine especially that's so important in this really long journey to get to where you want to get to. The effort and attitude every day is something you can't put forward, but like as a pre-med, like I can't be thinking about where I'm going to be doing my residency when I have to put in all this effort right now, you know?
Right.
So
All that good stuff will come,
right,
just
right.
focus on what you need to do at that
Exactly.
time. Yeah.
Exactly. So I do like that a lot. Thank you for bringing that up. And then along the lines of like failure and like setbacks and being hard on yourself and stuff like that, I think athletics presents a lot of that too. Did you lean on, a missed rep in practice or kind of approach some of those failures in the same way you might have in sports?
Absolutely. I mean, I think for me, like, it's just so part of sports to have the failures and the setbacks, and like, you're not getting to where you want to fast enough. But I think that did help me just because it's such an inherent part of sports. Like,
Yeah.
when I did have whatever I perceived as like a setback or even like a big obstacle, like people were kind of naysayers about dermatology. Oh, it's so hard. Like,
Yeah.
you have to get perfect grades. You got to get a great, step one score and all that stuff. And I just looked at that as like, all right, well, great, let's go.
Yeah.
Like
Yeah, I
you
like
just tell me
that.
what to do. I'll do it. I just
Mhm.
need to know those steps.
Yeah,
So I think I just accepted all that. And I think that that helped me also not get, as overwhelmed as maybe someone else might have been, like kind of seeing
right,
all these hurdles in front of them, where I'm just like,
right.
well, that's kind of part of it, right? Like
Yeah,
we all
yeah.
have to go through it. So
100%. Yeah. Or even the naysayers. I feel like in sports you get like the haters all the time or the competition and like you hear that and you're like, whatever, I'm gonna do my thing and like I'm gonna succeed, you know.
yeah.
And that's obviously what he did. Great. And then my last question for you involves a little more of the teamwork side of medicine. I've been lucky enough to work with you at Bernardo Dermatology for, a couple years on and off, but in this past year, a long time. But it medicine involves a lot of collaboration and teamwork, whether it be with like medical assistants like myself or other physicians or physicians you refer to. Um, have you found yourself bringing skills from athletics into like a team dynamic in medicine?
Yeah, for sure. I mean, as you know, medicine really, you could look at it as a team sport,
Yeah.
Like I may be the one kind of directing traffic, but there's nothing in that office that doesn't get done without
Right.
multiple people being involved,
Right.
whether it's, setting up for a biopsy or an excision or assisting in the excision,
Mhm.
right? Cutting sutures, grabbing sutures, setting up the tray, cleaning up, doing pathology requisitions,
Yes.
calling other doctors,
Yeah.
calling patients millions and millions of times,
Yes.
right? Going back and forth, so it's a whole team approach. And in terms of like leadership, I think that's where like your
Mhm.
individual leadership style comes in. And I find I'm more like try to just lead by example. I'm not a very like directive person, like you do this, you need to do this. And I love the whole like praising in public,
Yeah. Yeah.
tell someone what, criticize in private, right? But
Mhm.
always just try to make like a really positive atmosphere environment because no one works well when they feel stressed out,
Right.
right?
Right.
And so to get that really great team camaraderie, I just try to, lead by example, be really
Yeah.
positive, put in a lot of effort and people see me doing a lot of effort. Hopefully that rubs off on them
Mhm.
and also just the way we treat our patients. I mean, we have the best patient. I mean, sometimes we
Yeah.
don't, but 99% of the time we have
Yeah.
the best patients ever. And like making those amazing connections with those people. I mean, it's an honor to be able to take care of people. And I always try to find that, special way to connect with people. And then
Mhm.
hopefully the staff sees that too,
Right,
and it just
right.
becomes a
Oh yeah.
really special experience when you come
Yeah, definitely. Well, you're the first person I've gotten to interview who I've actually worked with, and probably the only for a
in.
while. And it's really cool to hear like your take on how your leadership abilities that you've developed probably through training, through sports, through all that, have kind of impacted how you lead now as a physician in that office. And I've gotten to experience, being a part of your team, what that's like. And I definitely see that. So that's something super special to hear on my end.
Oh, thank
Getting
you.
to ask you about that
Mhm.
too.